What if the most powerful treatment for depression wasn't found in a pill, but in a plate of bacon and eggs? For decades, mental health care has revolved around one thing: manipulating brain chemistry with drugs. But what if we've been missing a fundamental piece of the puzzle all along? A revolution is happening in psychiatry. And it's not coming from the pharmacy, it's coming from your metabolism. The standard model of psychiatry is breaking down. Millions of people are stuck in cycles of depression, anxiety, or bipolar disorder, despite years, sometimes decades, of medication. Treatment-resistant cases are on the rise. But a radical new field called metabolic psychiatry is challenging everything we thought we knew about mental illness. And at its center is a diet that's been quietly healing brains for over 100 years: the ketogenic diet. The brain runs on glucose, until it does not. We've been taught that the brain needs glucose. That's true, partly. But here's the twist. The brain is also perfectly capable of running on ketones, which are molecules your body produces when it burns fat instead of carbs. Analogy number 1. Think of glucose as gasoline. Cheap, easy to burn, but dirty. Ketones. They're like high-octane jet fuel, clean, efficient, and powerful. When people with psychiatric conditions switch to a ketogenic state, the brain gets an energy upgrade. Studies show improved mood, sharper cognition, and better emotional regulation, sometimes in patients who've failed every medication out there. Dr. Shabani Sethi of Stanford calls this a fuel problem in the brain, and ketones just might be the solution. Why ketones calm the mind? Here's where it gets really interesting. Ketones boost GABA, a calming brain chemical, and reduce glutamate, which causes overexcitation. They lower brain inflammation, which is now known to contribute to depression and other mood disorders. And they improve mitochondrial energy production, giving your brain cells the power they need to function optimally. Analogy number 2. Imagine a dim light bulb flickering in a dark room. That's your brain on impaired glucose metabolism. Now plug it into a clean, steady energy source, and suddenly the light shines bright. The evidence is in. Let's talk data. A study on bipolar disorder patients using a tailored ketogenic diet found 69% showed significant improvement in just 6 to 8 weeks. Other case reports show people with schizophrenia, major depression, and anxiety experiencing full remission of symptoms, often after everything else failed. One woman, suffering from treatment-resistant depression for over 25 years, reduced her PHQ-9 score from 25 to 0. That's clinical remission. She said, "I'm going back to school. I finally feel like my brain is ready to learn again." Citations: